So how do I heal? As a therapist, I try to talk little of the actual addiction or distraction. Much to my patients' dismay, the addiction is often the only thing they want to talk about. And instead, I try to steer the conversation towards the thing they don't want to talk about, the pain they're numbing. Tackling the addiction, trying to quit, exercising willpower, and creating better habits are useful pursuits, but they are the tip of the iceberg and are unlikely to really heal the root of the addiction. When we describe ourselves or others as someone with an addictive personality, we are really describing a person who is sensitive or traumatized and trying to regulate their difficult feelings. You can try to take away the substance or behavior, but the need to soothe will persist. I used to work in the NHS weight management service, giving therapy to people before they had weight loss surgery. And something interesting would often happen after surgery. Many patients were using food to cope, which I would call a food addiction, though some may disagree. But the gastric bypass surgery rendered those patients unable to eat enough to soothe. Their food addiction, in a sense, was cured. However, the pain they were using the food to cope with was not. What we saw was something called addiction transference. When one addiction transfers to another, the patients would adopt new addictive coping mechanisms like alcoholism or gambling. Through this process, they found a quick fix for the food issue, the tip of the iceberg, but ultimately the issue was never the food. It was the hole they were trying to fill, the bulk of the iceberg. So rather than beating yourself up for succumbing to whatever you may be addicted to, try to recognize that your addiction is serving a purpose. It is helping you to cope with something that feels unbearable. The task is to try to connect with what that might be, so you don't need to rely on the addiction anymore. I know this is really hard. It might sound incredibly scary. It did for me too. Unfortunately, sometimes things get a little worse before they get better. That's because to really heal, you have to go through all the painful things you've been avoiding. The antidote to addiction is connection. The opposite of addiction is connection. Connection to other people and connection to the vulnerable parts of yourself that the addiction is masking. The dopamine and endorphins that we seek through the addiction replace the love and connection we're missing. Addiction fills the void of connection and love. Even if you're surrounded by people, you might not feel deeply connected and loved if you're keeping your more vulnerable parts inside. The more vulnerable you are with safe people, i.e. the people who can bear and hold your vulnerability, the more connected you will feel. This is what happens in therapy. Slowly, people start to rely on their therapist and show their pain underneath. The therapist, unlike their parents, does not judge or reject them. They support and accept them. This is what heals. We cannot heal alone. Healing happens in relationships. This can be done outside of the therapy room by sharing your feelings with people and allowing yourself to depend and be depended on by others. The more genuinely connected we feel and the more community we have around us, the less we need to soothe ourselves with the addiction. This starts with connecting to yourself. Just knowing is not enough. Knowing what trauma triggered your addiction is very different from processing the trauma. People tell me all the time, I know exactly what my trauma is, but it doesn't help. They're right, because there's knowing on an intellectual level. For example, I know my abusive father had negative effects on me, and knowing on an emotional level. For example, feeling how scary it was to have a father who was aggressive and didn't feel safe. Lana knew what had happened to her, but until she was able to let herself express the confusion she experienced, the disgust and grief and horror, she needed to use work to cope. The same was true for Nathan. He'd always known that the bullying was what led him to start drinking. The work for him was to connect to the feelings of inferiority, isolation and exclusion, the shame he experienced as a young person, which led him to believe that there was something wrong with him. When Nathan first started to talk about his past, he described what happened to him in detail. How he had to partner with a teacher in lessons because no one would dare go near him. the silence that fell when he tried to talk to anyone, being iced out by the people he thought of as friends, the shame and confusion of the silence, the feeling of being so dirty and repulsive that no one would touch him. It was agonizing to listen to. I looked at him, expecting for him to be experiencing the same kind of sadness and discomfort I was feeling. And instead, he was beaming at me, sunny and upright, as if he had just told me a story about a cute dog he'd seen. He was not connected to the feeling of the words he'd just told me. Inside, I was feeling it for him. One of the ways we survive the painful things that have happened to us is by splitting off from all the hurt so we don't have to actually experience it. Entire memories of huge events get pushed down. The number of people who cannot remember large chunks of their childhood is astounding. This stops us from having to face any of the bad things that happen to us. Except they do not go away. They lead us to seek out coping mechanisms, even if we can't remember what it is we're trying to cope with. Healing is the work of rejoining all those separate parts so you can feel whole again, so you don't need the addiction to manage those unwanted parts. The story of what happened is connected to the pain once again. It's hard work to have to feel the things you don't really want to feel. That's why it takes time, repetition, and safety. Things changed for Nathan when he went into work one Thursday and opened his drawer to find that someone had individually wrapped all his items in wrapping paper. While his office mates sniggered and whispered, Nathan's eyes became thick with tears. He ran to the bathroom to hide his dismay and wept in the cubicle with abandon. His colleagues were alarmed. It was only meant to be a harmless joke, and Nathan was usually light-hearted and playful. They thought he'd take it well. As he tells me what happened, his colleagues laughing as he unwrapped his notebook and pencil, he struggles to get the words out, as if something has its hands around his throat. His jaw tremors, making his speech shaky and almost incoherent. It was seemingly harmless, but Nathan's reaction was disproportionate. While it might seem as though these feelings are about what's going on in Nathan's present, it feels to me like he's starting to process the past. I cannot tell you how common this is during the healing process. As we start to talk about the bullying he went through, the feelings come to the surface, triggered by the event that mirrored the past. While his colleague's prank seemed harmless and playful, Nathan is reacting to the bullying from when he was a kid. This is all part of what I understand as processing. While going through the therapy process, you might find yourself getting angry at a partner when really you're angry at a parent. Or maybe you find yourself crying at a cute child in an advert, when really you might be crying for your own child self. As we start to put words to the things that have happened to us, it's normal for difficult feelings to come up. By feeling all those vulnerable emotions, we're releasing the stories and shame that have been hiding inside us. Tips for connecting to difficult emotions. Number 1, give yourself permission to feel anything. Don't try to force how you're feeling. You might feel nothing or feel numb or flat. Maybe you genuinely only feel happy and positive feelings. Number 2, tune into your body. Feelings are just physical sensations, remember? So to tune into your feeling is to tune into your body. You can do this for yourself. How does your body feel right now? Give yourself a second to check in with yourself. Your body will tell you how it feels. You just need to give it space. Number 3, journal. Giving yourself a space to write freely, whatever you're thinking and feeling, can help release emotions you didn't even know you had. Give yourself a few minutes each day just to write, without trying to make it good or imagining that anyone would ever read it. You're trying to create a place free from judgment where your unconscious is safe to spill out. Number 4, connect to your inner child. Sometimes it's easier to feel empathy for a child than for ourselves. Visualize yourself as a child and try to imagine how they might have felt. Did they always feel cared for? Did they sometimes feel lonely or misunderstood? Try to imagine exactly how it felt for them during the more difficult times. What did that little child need back then? What do they need from you now? The more we visualize and connect to our child selves, the more we can have compassion and empathy for ourselves and start to connect to that little child's painful feelings, which we might have shut ourselves off from. Chapter 5: Self-criticism.